Hi, I'm Molly Sullivan with Golfers MD, your source for all your golf, health, fitness, and injury information. Golfers are prone to PCL injuries. The PCL is a posterior ligament that attaches the femur to the lower leg and can be injured or torn by a sudden twisting of the knee joint or from hyperextending the knee. The pain and injury will cause golfers limited mobility and even misplay. Today we visit Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about PCL injuries.
A PCL injury is a ligament injury in the knee. The ligament is a rope that connects the thigh bone to the shin bone, and it helps support the shin bone from moving backward. An injury to the PCL typically occurs with a direct blow or direct injury to the front of the shin bone when the knee is bent. The symptoms of a PCL injury initially are pain, swelling, and stiffness to the knee. Later on, as the initial symptoms resolve, there really is very few symptoms except for in the severe cases. The treatment for a PCL injury initially is for physical therapy to recover the range of motion and the strength. If the injury is severe or if it's combined with other ligament injuries, surgery may be indicated to reconstruct or replace the ligament itself. An athlete with a PCL injury in a minor injury usually can return to play once the initial symptoms resolve, but for more serious injuries, and as I mentioned, with other injuries involved, surgery is usually recommended.
The rehab is a very lengthy process, very similar to the ACL, which is the anterior cruciate ligament. The reason why it's very lengthy is because you have a tissue that's healing, and it has to become strong enough to withstand some of the forces that you want that athlete to go back and do, such as running and jumping, rotational movements, explosive movements. We also want to strength train the entire lower limb and do neuromuscular training, which is, again, connecting that ligament sensors to the muscles so that the muscles sit on ready quicker to get that ligament out of trouble if they're going to tear again. So the rehab, again, is going to take a good 6 months before they get back to full play. I don't care if you're a professional athlete or a weekend warrior.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with GolfersMD.com. Remember, at GolfersMD, health equals performance.